So October is Breast Cancer Awareness Month, and I'm very excited and happy to have three guests here at the clinic today. Dr. Houriya Kazim, who is the director and owner of Well Woman Clinic and a breast cancer surgeon. Rana, who recently found out that she had breast cancer and opted for a double mastectomy. And Reem, who didn't have breast cancer, but you had the gene. Yes. And so you tested positive for the gene that carries the breast cancer. At a very young age, you found out that you had that and opted also for a double mastectomy. So maybe we can start off by talking about the gene. Dr.
So the gene that we're talking about is actually a gene mutation, which means a change in a gene which increases your risk of certain cancers. We know that there's some gene mutations that strongly increase a woman's risk of having breast cancer, ovarian cancer. There are others that increase your risk of other types of cancer.
So you don't have to have a family history of breast cancer. You can have a family history of ovarian cancer, for example, to have the gene that carries
So the same
cancer.
mutation can increase your risk of multiple types of cancers. Usually they're groups of cancers. So the one that, or the ones that can increase your risk of breast also increase your risk of ovarian, and in men prostate, sometimes colon cancer, sometimes skin cancer, and pancreatic cancers. And you have some other groups of mutations that cause that can increase your risk of other types of cancers, like intestinal cancers, uterine cancers, that kind of thing. So with Reem had a family history and opted to have a genetic test done, and was found when you were about 30? 30. Yeah, to have a mutation that would increase her risk of breast and ovarian cancer.
30 is a very young age.
Yes.
To find out that you have to remove both breasts. So just to recap, if you have the gene, your chance of getting cancer is almost 100%? Or
no,
what,
it's about 80%,
so
for breast and about 45% for ovarian, though ovarian is the worst of the two. The issue with being young and having the mutation is the best screening tool we have for breast cancer is actually mammography. But mammograms, which are x-rays of the breast, don't show too much information when your breasts are very young. So that means then we have to add things like MRI. You don't 100% have to remove both breasts. Obviously, that's the best way to decrease your risk from 80% to almost nil. But there are women who choose not to do that, in which case what we will do is enhanced screening. So we'll do mammography, we'll do MRI, we'll do physical breast exams every 6 months.
Yes.
And there are some other things that we can do for genetic mutations. There are some medication that you can take, which we give to breast cancer patients, which will decrease the risk, not as significantly as surgery. So there are some options, but the best in terms of having a big change in your risk from high to low is risk-reducing surgery, which is removing both breasts.
So at the age of 30, what made you do the test?
It wasn't easy, but I think seeing my mom go through that, it just made things more clear that I needed to do something, especially having a son. It really, and seeing my dad, seeing my family go through what my mom went through, I wanted to do something for myself and for them, just to get it.
So that they're less stressed out, or that they're less worried.
It's, I mean, for me, it's the best thing that I ever did for myself. I felt in control of my own body, my health, and it was the right thing to do.
Was it difficult to have the double mastectomy, to lose your breast, or did you feel like instead of losing something, you gained something? Like what went through your mind?
Yeah, it was hard at first, and then of course, mashallah, I met the amazing Dr. Houriya, and I think having her supporting me, talking to me, then I didn't have really the group I had now, but just listening to her and researching things. And I think mostly it's my mom, my family, my dad, my brothers, just them wanting me to be with them, wanting me to be healthy. going through, as she said, Dr. Houriya, the screening. The MRI wasn't something I really wanted to do again. It was really scary. And I had lots of pain in both breasts. So that was something I wanted to never feel again, because I couldn't really hug my son. I felt so much pain. It was very tender. And that really gave me the strength to have it done. And especially when I did the tests, and knowing that I had the gene, I remember the phone call, Dr. Houriya, she called me and she explained to me, and I was like, I have the gene, I'm gonna do something. My mom, before she passed away, said that she wished that she could do something. She wished that she found this earlier. So that happened to me. I got that chance. So why lose that chance? Why not give myself that amazing gift of just having an amazing life, moving on?
My God, that just gave me goosebumps. That's just so, I often feel, we see a lot of patients, and I feel like everybody comes with a different attitude and a different way of looking at something. And that is such a special way. Like, you look at it as a gift.
Yes, and Reem's always been very pragmatic about it, in the sense that, okay, if I have this is what I'm going to do. But I mean, that's not to say everybody is like that.
Yes,
I mean, Reem was young, and of course a lot of the women that we see are young as well, and some of them have not been able to make that decision, or certainly not been as pragmatic. Some, it took a little bit of time, and some even now, as you know through the group, that there's some who still haven't brought themselves to do it.
Yes.
So I think everybody's different.
Yes, and I think we definitely need to revisit that again later on during this conversation, because I mean we know a lot of people that have the family history but are afraid to even check that they, if they are carriers, or if they have the gene.
Then number one, if you don't do anything and have that information, then you have this thing sort of sitting on your head.
You have to be prepared.
It gives you a lot of worry. And then if you are going to go through with it, it's big surgery.
Yes,
it's one thing to do surgery like that if you have cancer. It's another thing when you're a perfectly healthy 30-year-old and you're going, okay, here, take my breasts off. It's a very big decision.
So Rana, you recently found out that you had breast cancer. What was your reaction when you found out? What was the one thing that really stands out in your mind?
So actually, I've been struggling with pre-cancer for a few years. So I was always doing a lot of checkups, going to Dr. Houriya, doing MRIs, as Reem said, the ultrasound, and it's not, an easy process. And every time you go through an MRI, you think, oh my God, what are they going to find? And then I had a small operation when they removed the pre-cancer cells, and then Dr. Houriya called me and she said, in between the pre-cancer, we found very few microscopic cells, which are actually cancer. For me, that was it. It was a very easy, very difficult situation, and I took it right away. I'm like, we're going to have to do the operation. I wasn't hesitant because I have 3 kids. I have my life ahead of me, and Dr. Houriya, I remember she told me, if you don't want to do the operation, you can continue doing the MRIs and the ultrasounds, but I was done with this roller coaster of emotions. I just didn't want to have it anymore. And I think for me, it was the best decision. Yes, it was a difficult operation, but it's all about the mindset.
Yes.
So I remember when I went out of the hospital for 4 days later, I called you or I saw you and I told you, I drove, we went to a coffee shop, and you're like, no, you're not supposed to drive. So I was already...
I get that a lot, by the way. I'm so happy and relieved after surgery. It's like they go drive. I'm like, wait a minute, you're not...
Go have coffee.
Go have coffee.
So yes, it was painful, it was difficult. 3 weeks later, I was back to the office. I was managing, alhamdulillah. It was a difficult process.
But you decided to do both sides.
Yes.
So why is that?
Well, I think we need some background to your story.
Yes.
So Rana first had pre-cancer on one side.
Yes.
And that was treated by preserving her breasts. And then she continued to have high-risk screens. She's got a family history of ovarian cancer, and she did do a genetic test, which was negative. So we didn't feel at that time, when she had her first diagnosis, that she needed to remove both breasts. though she had quite difficult breasts to screen. So she was going through, as she said, with the high-risk screening, which means one-time mammogram, one-time MRI every 6 months. And then we found something on the opposite breast. And that one also came back as pre-cancer. But when we operated by doing a breast-conserving surgery, we found that actually cancer was already there. It had already progressed to the next stage. So I think the worry is that in spite of her having screens every 6 months, in spite of her having a negative genetic test, we still picked some, yes, we picked it up early, but it had still already progressed to the stage we didn't want it to progress to. So that's where, from a medical point of view, when you said, I want to remove both, for me, that was a good decision.
Yeah.
Yes. And would you, so now that you've done it, would you, looking back, would you have removed both breasts before, like way back when?
Absolutely. Now, if I had the chance, from day one, when I saw the first pre-cancer, I would have removed both. Not to go through all these screening, not to go through all these worrying, it would have been much easier. And I'm happy now with the result. I feel healthy. I don't have all the worrying in my head.
Yes.
Yeah.
I mean, I think the decision is still, it's a difficult one. I do get people who come to me, and most breast cancer patients from the beginning say, remove everything.
Yes.
And I don't think that's necessarily true for everybody. I mean, you had cancer on both breasts. I think that's a genuine reason for removing both breasts. And also the fact that with screening, we were still picking it up, not as early as we wanted to. But I think, it is definitely an option for women, but this is not to make it as something flip. It is big surgery.
And I think we have to be very careful that, I think each woman has her own journey.
True.
And her own sort of risk factors. And so it's not like a cookie cutter, cut and paste for everybody.
But it is big surgery. And the more surgery you do, the more potential complications are there. So it's not something that everybody walks in and we go, cut both breasts off, but then they'll make you 2 nice breasts. And that's it. It is something that we do think about a lot for each patient individually, as Buthainah says, because everybody's journey is different. Everybody's case is different. Everybody's biology of the tumor is different.
And so if you had to, actually, let me rephrase that. Would you have made a different decision had you not had kids? Meaning, did having kids make it easier for you?
Yes.
Yes, that was an easy yes.
Yes. Yeah. Just wanting to be there for them, seeing them worry. That was really hard.
Yeah.
So that was.
How old was your son at the time?
He was 5, maybe 6.
So he was aware, you think?
He was aware
he felt it.
that his mom wasn't feeling well. And because of my mom going through that and him living those days with my mom, he knew that mom going to the doctors, coming back, is she fine?
Yes, he associated the two.
Yes, and he, mashallah, children, they feel, they actually understand. You try your best to have this calm and, like being there for your family, but they all noticed. And that's the thing. As Dr. Houriya said, everyone has their own story and why they want the surgery to be done. But it's mostly being ready and having faith, and doctors, of course. When you have a good team, and they actually support you and they listen to you. They don't just give you the information. All that as a package, it just was right for me to do. True. Just to live with no worry. Yeah. No worry, people might think I thought I could do that. Have tests done, come and see Houriya Kazim, sit with her, talk with her, and I'll be fine. And I was fine. But when I went back home, waiting for the phone call, that was taking my health before anything else.
Absolutely.
I didn't have to have cancer to go through the worry every single time, listening, waiting. My life was really, it was just waiting on the
edge. You just wait, waiting for some news, whether it's good or bad. You're just waiting for that news.
Yeah, and then having the good news, and then you're like, 6 months.
Exactly, 6 months.
6 months time. And you have a calendar, and you're trying to live your life. You're trying to be happy, and then you have a small pain Or if you sleep and you wake up and you have this weird feeling and you're like, okay, I have to go and see Dr. Houriya sooner than, and that alone was just like, enough is enough. I need to live, I need to be happy. So yeah, that was really the reason why. You just, I think, love yourself.
Yes, that's a nice way of definitely looking at it. Yeah. And if you had an advice to give, let me say, you met somebody, I guess you guys are all part of a group as well, right?
Yes.
Each one of you have a support group. You have the breast
So we have
friends.
breast friends, which are for cancer patients.
Yes.
But also Reem takes care of another group that we have, which are for patients who have a genetic mutation.
Wow.
Now, some of these have had surgery already. Some of these may be about to have surgery, and some of them have tested positive but have chosen not to. And so they get support from people who've actually gone through the surgery, so that they know themselves what to expect firsthand from someone who has.
Do you think that having this support group, were you already part of that support group before the surgery, or is that something that you was part of that support group after the surgery?
Before I joined the group after the surgery, I had many friends in Dubai, many ladies who had already breast cancer,
Wow.
and many of them were patients of Dr. Houriya. So when this happened to me, I reached out to them and I had discussions with each one of them, and I asked them about the operations, about their treatments, about their journey. And actually, they're the one that made it easy for me. Like, look at them now. They're happy. They're doing sports. They have their families. And whenever I had doubt, I would reach out to one of them, especially the positive ones. And now, actually, after all I've been through, I became a support lady to other women. So now they are reaching out to me, like, we've seen you passing through this journey and you were doing fine. So what happened? Because it's happening every day. Ladies are getting breast cancer every day. One of my friends, she's 35. She was just diagnosed.
I mean, basically,
very young, right?
Most cancers are on the rise, and breast cancer is definitely one of them. So, everybody knows somebody who's had breast cancer. So it is a common thing. And I think the important thing, and you do a great job with that, of, coming out and talking about your story, is so that people have that human face, that, we still have that kind of scare. I think it's natural that you hear cancer and everybody kind of goes, But it's important that people know that, yes, you can have cancer, and then you have your treatment, and then life goes on. And the nice thing about, the numbers where I was saying that, breast cancer is on the rise, most breast cancers, more people are living after having had most types of cancers today than in the past. So in other words, more people are getting breast cancer, but more people also surviving it. And a lot of that is treatment. We're treating breast cancer better, and also we're picking it up earlier.
And I see that so much now that we're picking up early.
So I think that's important.
Good point. So, we always talk about mastectomies and single mastectomies and double mastectomies. And one can have just a plain mastectomy, meaning you remove the breast and you can actually keep a lot of the skin behind. You can even keep the nipple behind. But you can also opt to have an immediate reconstruction at the same time as the mastectomy. So you actually end up waking up with a new breast. So yes, you've lost your breasts, but you're waking up with 2 new breasts, I guess, or 1 new breast, depending if you've had a single or a double. And you opted to have a reconstruction, meaning you had the double, actually both of you guys had the reconstruction. Would you have done something differently? Or what went through your mind? Did you know that there was that option of having a reconstruction to start with?
Yes, just knowing that, I think it made it easier, a lot easier.
True.
And sitting with you, talking to you, seeing the before and after, did make things more easier. I felt happier. I felt happy. I would wake up and have a part of me back. I'm not losing it completely. So that did really help, yes.
I like how you say happy.
Yeah.
Because it's so you, right? It's so you're very practical.
Yeah.
And how about you? Would you have done it again, or do you feel like?
I remember when I came to your clinic and you were showing me the before and after, I was super stressed. Remember, I told you, please let's stop. I'm really nervous.
You came with your husband,
with my
yes,
husband.
and he wanted to see, and you were like,
yes, and but after some time, I was like, no, this is a good thing. I'm getting, as Reem said, my breast back. It's fine. But at the beginning, it's not an easy decision. No. Even when somebody has, like me, breast cancer, to lose an organ, it's not easy.
And two.
Yes.
In my case, I decided to go for 2 because for me it didn't make sense. If it happened in one breast, it could happen in the other one. Why to go through all of this again? So I decided to take both at the same time, and I got the reconstruction. And from day one, I felt okay because, when you wake up from the surgery and you feel I still have my shape, it's okay.
Yes.
Psychologically, for a woman, it's very important.
Yes. Okay. Your turn.
Okay. All right. So I'll talk a little bit about mastectomies.
Yes.
Okay. So when we come to the decision now that you need a mastectomy or a double mastectomy, that means removing the breast tissue. And historically, the way we did it is we'd literally just amputate the breast. So you remove the breast and you'll be completely flat. And there are a significant number of women that are quite happy to be flat. I have professional basketball players that love the idea that nothing's bouncing around. So that is fine, but that's what constitutes a mastectomy. But over the years, Buthainah and I have been doing something that's called skin and nipple sparing mastectomy. So what we basically do is save the outside of your breast, the skin, a little bit of fat, and the nipple, and we go from underneath and we just scoop everything out from inside. So we're scooping the breast tissue out. That's the tissue that wants to become a cancer. And you save the skin and the nipple. So then
But the reconstruction then becomes obviously much nicer and much easier.
Exactly. So then when you reconstruct it, what you're doing is just replacing the volume of where that breast tissue was. But when you wake up and you look down at yourself, you're still seeing your skin and your nipple. It may not feel the same, but it is still you.
Yes.
It's not flat.
Yes.
And I think the advantage, sorry to interrupt you, but the advantage of catching it early is the fact that
we can save.
You have that option to save more skin or the nipple or whatever it is. You have that option.
And also, I mean, from a cosmetic point of view, there are other things that you can do at the same operation. So you have some women that have very droopy breasts and they would rather have not so droopy breasts, and there's some women that it's big and they want to be smaller, and some women that are smaller and want to take the opportunity to go bigger. So at the same operation, after removing the breast tissue, we can actually adjust that envelope of skin to make a breast that's acceptable to the patient.
Yes, absolutely.
What advice would, let's say you actually do that because you both are very active in talking to patients who are either recently diagnosed with breast cancer or patients who have the BRCA gene. What advice would you give them?
So from my point of view, ladies should definitely go and do the screening. This is not a joke. They should take it really seriously, especially if they have family history. Many of my friends, they have their moms, their aunties, and they're too scared actually to see doctors. And I think this is completely wrong. And then I tell them, look at me. I didn't have it. I mean, I had my auntie who had ovarian cancer, but we never had breast cancer in the family. And only because of early screening, I was able to have the reconstruction. My treatment was very easy. So they should definitely take it seriously. And instead of Googling it, just talk to other women, because Googling sometimes makes things so difficult. But when you
very confusing.
Very confusing. Yes. After the operation, when I was reading about the operation, I read that you cannot sleep, you cannot lie down, you have to sleep sitting on a chair. And then I called one of my friends. She's like, no, that's not true. So just talk to other women.
And see how these little things become important. Sleep.
Yes.
After surgery.
Yes.
That's all these things that we take for granted as okay, well, we're gonna, that's what worries people. Well, how am I gonna sleep after? How am I gonna have pain?
Exactly.
That's a big thing.
And I think the internet is always biased to the negative, right?
Yes.
People tend to put things on there when they've had a bad experience. It could be anything, not just surgery.
True.
It could be a bad meal in a restaurant. You tend to write about things that have gone wrong rather than how good when things have gone the way they're supposed to go.
Yeah.
So that's what I tell patients is like, it's okay to read stuff on the internet because hard nowadays to say don't ever go on the internet. But I think just keeping in mind that it's always negative. I had one patient say to me, she said, I read that it's excruciatingly painful, and I was like, really? Because patients, even if they have pain, they wouldn't say it's excruciatingly painful. So I think, you have to be so careful. And of course, as Buthainah says, those are important things. If I'm going for a surgery, I want to know if I'm going to have pain. I want to know if I'm going to be able to sleep properly.
Yeah. It's not just how you're looking afterwards.
Yeah.
It's not a matter of losing the breast. How are you going to look after that?
It's all your daily
the pain.
things. Yeah.
How am I going to sleep?
Can I drive to the coffee shop?
Can I blow dry my hair after surgery?
Yes.
These are very, very small points that we take for granted that So what advice would you give?
Support group, family, and just talk to positive people, definitely, and ask questions, never hold back. And that's the most important thing. And now with the groups, we can do that for other women. For me, I took your word and Houriya's word of the pain and everything, but now actually the women are talking to me and asking me questions, and I'm like, I have the confidence to say, don't look on Google, just talk to us. And the pain, there is pain. Will you be able to jump and walk and do certain things? No, but it's...
But immediately after. But afterwards you can.
Now you can.
The pain is medication. Now it's a different time where everything was... it's easier.
Yes.
It's easier to
we're
get
so blessed.
out the message. When you go through something, it's easier to tell them exactly what you went through. And you really help them.
And that's why the group's so important.
Yeah.
It's firsthand.
How many people in this group?
So with the BRCA, I'm not sure.
I think we have 20.
Okay.
Yeah, and most of them, mashallah, after they actually, I had the surgery, and then one of my best friends, we had the group, and I think 4 women joined. And then suddenly we've noticed that they're going for the surgeries, they're talking to us, we had the surgery, we went in, and then it started to happen anyone that Houriya tells me about, in the end they talk to us, we give them the information, and they go for the surgery. So it's really, it's an amazing thing.
Amazing, because you're changing, or you're affecting, and maybe saving people's lives with these groups. And what about the breast cancer, the breast friends?
I think we have over 600 on breast friends. Yeah.
And are they part of a WhatsApp group as well?
We have WhatsApp. We have Facebook.
Wow.
We have
because you've been, how many years now you've started that?
So we started, the support group itself started in 2005, and we've been meeting consistently every month. In fact, there's a meeting this morning. And then we also started a cancer drop-in center. So that is run every day during the week. It's the Majlis Al Amal.
Al Amal, amazing. When you say cancer drop-in, you mean women?
Any woman with any type of cancer can just walk in, and you can talk to people that are there. We have a library. We have resources, that you can access. And then through the drop-in center or through our monthly meetings, we do yoga classes, and I think there's sound healing this week, and there's all kinds of things that are for free.
Wow. Wow. I love the idea of the drop-in center, because I can just imagine if you've just been diagnosed and you're agitated, you don't know what to do.
And you can't wait for a monthly meeting. So it's nice to know that you can just go there, and they're usually
other people
women
who have gone through something similar.
Exactly. Well, can we get personal about partners?
Okay, can I have a cappuccino?
And can I have some water?
We often talk about the mastectomy, the reconstruction, but what about the day-to-day life after? You're both married, you have kids, you're going out, you have to wear things. In terms of the husbands, how did your husbands take this whole decision?
In my case, my husband was very supportive. He went with me to every doctor's appointment. He was there, outside, waiting for me after surgery. When we came back home, he was, until now, he's still very, very supportive. If I have any doubts, if I'm worried about how I'm looking, what am I wearing, he's always there to support me. Always you're looking gorgeous, you're looking amazing. He talks about
Was
my
he
spirit.
scared? Sorry.
I'm sure he was very, very scared. At the very beginning, when I was diagnosed with pre-cancer, he was at one of the clinics, like listening to the doctor. I looked at him and I saw him just holding his head in between his hands, like he just didn't want to be there. He was very, very scared. But slowly, I think also my positivity was contagious, and he started, looking at it at a positive way, like, no, she has hope, it's still at the early stages, we can do something about it.
Amazing.
But support of family, support of the husband specifically is super, super important. And also friends.
And friends. And, the thing I find that when a woman comes with breast cancer, I don't want to say we forget about the husbands or the partners, but it is very scary for them too.
Yes.
And, we often find husbands afterwards come and say, look, if any of the other husbands want support, please call me.
Yes.
And they're there also as a support, because they've obviously gone through something and they cannot, everybody expresses their doubts or their fears in different ways. It could be anger. I mean, it could be sadness. It could be all sorts of things. So I think we have to often take that into consideration as well.
Yeah.
But I think the psychology of men is different. You know, they're used to sort of fixing things for us. The bulb needs changing or the chair is broken. And then they're faced
we all know that.
I know. And then they're faced with something they can't fix.
Yeah.
So they really don't know what to do.
Yes.
And I often have husbands will come to me without their wives knowing, asking me, what do I do? And I'm like, just give her a hug. Listen, just tell her it'd be okay,
exactly.
because they're so used to want to fix something.
Actually, that's good, because what advice would you give a man whose wife is having breast cancer? And that would be to listen, just to listen to her
and support her and hug her. And sometimes you don't even have to say anything. It's just,
true.
it's just that she knows that you're there,
How did your husband take it?
I think, as she said, the way I was dealing with it, he was getting that strength from me and support from the beginning.
Alhamdulillah.
He was like, just do what you need to do to be back, to be Reem, the one that I know. So it was an amazing. It was a scary, really scary time, but it just showed you the people in your life, and you appreciate them more. There is nothing you can go through in life that. The situation that I was in, actually, I knew my husband. I knew my father, my brothers, my friends, and they showed me that we are your support, no matter what. So that really made things, even for him. My family actually saw him and appreciate him, because he was with me all the way.
In terms of decision making, did you sit with your husband? Because you had choices.
I think I was the one mostly wanting, like he would have maybe preferred more screening. Surgery, I think, to my husband was a little bit more what if I lose you? And I was like, you're losing me now. I'm not with you. I'm not concentrating. I'm not sleeping. And I want to be back. I want to be your wife. I want to be the mother. I want to be the sister. I want to be the friend. And he was like, whatever you decide. And I think that's when we became a team. He saw me going for something and he was backing me up.
Okay.
He was trying to fix me in a way where he just drops me to my appointments, listens to me, and as you said, listening and hugging, being there for you, and just respecting your decision. And I think respect, for him to actually respect you and believe in you, that you're doing something to survive, to be there for him.
Yes.
That was the most amazing feeling ever. I think all those feelings, even though I was terrified and scared, those feelings were just attacking the scary part of everything. And the love and support. That was the most amazing thing ever.
Yes.
Yeah.
Alhamdulillah.
Alhamdulillah, yeah.
Well, it's interesting, the breast in terms of how women view their breasts. I've had women who are very attached to their breasts, who literally ask me how many grams I'm going to remove, literally. I have personally for me, my breasts were to feed babies. Okay.
But you're also a very practical
I am
person.
very, and I don't have
Me being the plastic surgeon, it's a little bit different.
For me, I'm like, it did its job and halas, right?
Yes.
But I get that not everybody is like that. And so there are some women that it's a very difficult decision for them to make because their whole sense of femininity, the breast is a big part of that. And that is when we get into trouble. So when we actually have somebody that maybe needs a double mastectomy, but they're so attached to their breasts as part of their persona that we have to remove. And I think part of that is helped by the fact that we can actually save the outside of the breasts and just remove the inside part. I think that's a big part of that.
Yeah.
But it is difficult for some women. There's some women, it's, as I said, it's...
And you're very right about that because, I have some women, after you refer them to me for reconstruction, some women come to me and they really want a reconstruction. And they talk about, okay, I want different sizes and I definitely don't want to wake up without a breast. But I have other women who come and they're like, I don't care. I just want to survive and I don't care. And I'm like, well, then you don't need to see me.
Yeah.
And it's okay.
Yes.
Because they feel, oh my God, I have to have a reconstruction. Or, and then some of the others are like, I don't want to wake up without. So it's such a different, and each person is so different that you really have to get a sense of what a woman wants.
Exactly.
Yeah.
And every woman is so different in how they see themselves and what they think about their body and losing parts of their body, So I can understand, even from your husband's point of view, especially because you didn't have cancer.
Yes.
If somebody has a disease and they have to have surgery, that's a whole different thing.
Yes,
Stick to the screenings,
Yeah.
stick to the tests,
But for you to have big surgery when you're perfectly fine, then that's another kind of...
and the truth of the matter is you were perfectly fine, but you weren't perfectly fine here.
Yeah.
And I think that is people don't realize that is actually such a big driver to your decision making.
Yeah, definitely. It's as if someone told me, and especially because I had the BRCA gene, I was just waiting, what if one day I get a phone call and they say that, I'm really sorry, you're too late. So that seeing my mom and having family members go through this, I preferred to do it. Yes.
Yeah.
Do you think having had breast cancer or potentially, or having had that scare, let me put it that way, change your life? Like how did it change your life going forward?
It's like another hope for life. It's another chapter, a new one. You're sleeping, you have breast cancer, you wake up, you're given a new life. And it's our choice what to make out of it. So we need to make changes, like to enjoy the rest of our life in a better way. For example, if we're so stressed at work, we might change, our work or the way we deal with stress. So it's just a new hope, new life.
So you've written a book before.
Yes.
And are you going to write another one?
I hope so, yes.
on breast cancer?
It's about my journey, but it will include a lot of the breast cancer stories, yes.
Looking forward to
reading that. Compared to that girl who was maturing in and growing up in Beirut and finding her life partner to the person you are after breast cancer, different person, same person?
Absolutely different, much more mature, looking at life from a completely different angle. My priorities are completely different. The way I value people is different. We change as we grow.
Anyway.
Yes,
even without
but
cancer,
then when we pass through a very strong experience, you change even faster. Yeah.
Definitely, yes.
So Reem, how about you? That scare, how did it change your future, I will say?
I appreciate everything from my family to just a simple thing. I just see things differently.
Yeah.
And really, I actually, it's mostly the appreciation, and I'm very hopeful. It's just like, it's totally, I'm a different person.
Yeah.
Totally different person. I'm better because of the chance that Allah gave us, gave me as a, it's something that I can't even, sometimes I can't really explain it. When someone asks me, I can't really tell them what has changed in me, but I just keep telling them, I really hope that you can see me every day and you will know. What this
I see a difference in your expression, and it's very different, right? I mean,
Yes.
obviously, it's 10 years later now. Where I met you when you were,
Yes.
or 11 years ago, I
Yeah.
think, is when
11,
we first met. But I do see a light, like
Alhamdulillah.
somehow
Yeah,
a light in
alhamdulillah.
your eyes.
Mashallah.
Yes, yeah.
Yeah.
So let's finish off. So let's finish off in one word. What? Give me one word to summarize how you feel now. I will say
I'm so grateful.
grateful.
That was exactly my word, gratitude.
Yes.
Alhamdulillah.
Yeah, for everything, for the new chances, for the medical team that we had. I mean, honestly, you, Dr. Houriya,
Yes.
my oncologist, I'm so blessed with an amazing medical team.
Alhamdulillah.
Yes.
Yeah, and not everybody has
And
this
we're
chance.
so blessed that to be part of these like
Journey.
incredible
Yeah,
journeys.
it is.
Incredible
It
journeys.
is. It's quite a privilege, you know, what we do every day. You know, I know it
Yes.
just
Yeah.
looks like we just go into the operating room, but, you know, we feel like we are part of your life.
Yes.
And I can say, I think you feel the same. And really, I mean, mashallah, having you guys in our life, meeting you in the moment where we were just
Yes.
lost,
Yeah.
really, you brought us back and you made us feel that there's a life after this. You will have another new life. And we believe that.
Yeah.
And that's why we had the support. Before family, they're there for us. But when we come into your office, it's in your hands. You make us want to do the last step. And going into a surgery isn't easy, especially doing something that we had to go through.
Yeah.
You made it absolutely an amazing adventure.
Yes. Yeah. True.
That's a good way to look at it. It certainly is.
Thank you. But again, I will say it takes two, and I don't mean us two, but it's it takes two. So I think you also come in with a good attitude. Does make it much easier.
It does.
overall. So thank you guys.
Thank you so much.
Thank you much for coming.
Thank you.
You know, I think that was so helpful. I'm sure to so many people.
I hope so.
Yes.
Yeah.
Yeah.
Inshallah. Okay. Thank you.